Good evening. Can everyone hear me?
I can hear you.
My name is Terry Spain, and I'm going to give it a few more minutes to see if we have a few others to join us. Our topic tonight is insurance and bariatric benefits. I see some names, or I've seen some people that had registered that has already started in our program, and some names I'm not familiar with, but you may already have had an appointment as well. So hopefully we'll go over some information and answer some questions that you have, and then we'll take questions as well before the end of the support group. Can everybody see my screen? Good deal, good deal. All right, we'll wait. Well, we'll go ahead and get started, and if anybody joins in, it won't be hard for them to catch up. Like I said, my name is Terry Spain. I'm the clinic administrator. I work with Vivian and Ginger, and lots of times there's questions about, does my insurance have bariatric benefits, or what is the coverage, or what you need to know from that standpoint. When you come to see Dr. Penson or Dr. Cawthon, you're not worried. You shouldn't have to worry about, how much is it going to cost me. We want to take care of you and get you through the program so you're on your journey to a new you. For those of you that may be just new and inquiring, to determine if you are a candidate for bariatric surgery, you need to have, there's a few options. If you have a BMI or a body mass index of 40 or greater, most insurances that has benefits, they don't require you to have anything else specifically, because the BMI will take care of it. They want you to be unsuccessful with previous weight loss trials and with diet or exercise. The other option is if you have a BMI between 35 and 40 with one or more specific health problems. These will vary by insurance companies. The majority of them will have the standard ones, and we'll go over that in a slide in a few minutes. And then those that are below a BMI of 35, they can be considered as a candidate as a self-pay patient. Now, effective the end of 2022, the American Society for Metabolic and Bariatric Surgery changed their criteria. The criteria that we have used was originally written in 1991, and they had looked over data for all these years, and they determined that bariatric surgery should be considered for individuals with metabolic disease, and their BMI is 30 to 34.9. So that is something that's great, new, and exciting. I can tell you that with this change taking place, I only know of one insurance that has changed to where their BMI is like 32 and above. So it'll take a little while for insurance companies to change and accept the criteria specific to the ASMBS, is who we use. Most insurances and our program bases the criteria. The general list of specific health problems that are pretty much standard across all carriers is obstructive sleep apnea, type 2 diabetes, hypertension, hyperlipidemia, coronary artery disease or CAD, and then non-alcoholic fatty liver disease. Now, if your BMI is less than 40, if you have sleep apnea, that's pretty much the go-to diagnosis for all insurance carriers to cover, but not everybody that has a BMI greater than 35 will have sleep apnea. Hypertension, when we first started our program, if you were on blood pressure medication, that was sufficient. Now, some of them are requiring you to be on up to 3 medications. They call that refractory hypertension, and it's still not being controlled medically. We do look at the medications and we make sure, because sometimes you can be on 2 medications and one medication may have 2 medicines in it. So don't get frustrated if you're only on 2 and think, well, I don't qualify, because if it could be a combo medication, you might still qualify. But these are the general list that most insurances accept if your BMI is below 40. Just general information about our program specifics. We want our patients to be 21 years of age, and we stop rendering surgery at age 69. We require you to have a referral/clearance letter from your primary care provider. It could be a nurse practitioner, females, it could be your GYN. It's just somebody that's managing you medically. Somebody that you see on a regular basis. You know, if they prescribe medicines to you, they can make the decision and decide and do a referral saying that you've been a patient of theirs for so many years. There's no reason to preclude you from having surgery. Then the dietary assessment. Ginger meets with all our patients. She, assesses, your eating habits, makes recommendations, and kind of gets you going on the right track, prepares you from the time that you're in our program till the time that you have surgery. Our program, as well as all insurance carriers, require a psychological evaluation. The main reason for that is you may have something. You may have had a tragedy in the family. You may have something else that needs to be addressed, so you can focus on, everything that you need to do to be successful after you have surgery. Some of our patients do counseling sessions. The majority of our patients, after they see the psychologist, talk to the psychologist, most of them are cleared. But it is a requirement from your insurance company. For our particular program, our surgeons, if you are diabetic, they want you to have an A1C of 8 or less. If you are running higher than that, then either with your primary care provider or an endocrinologist, they'll ask you to have an A1C prior to surgery of 8 or less. You're going through a bariatric or a weight loss program. So the goal is for you to lose weight. We, as well as your insurance, we don't want you to see you gaining weight while you're going through the process. There could be unique situations or circumstances, but if you gain weight during the program, sometimes your insurance company, when they're looking at all this information that we send them, whatever they require, we're sending that information to them to review. So if you were at a certain weight and then you had 6 months weight management, and on the third one you gained 15 pounds, the goal would be before you had your 6th visit to make sure you have all, get back to where you were when you started the program. And then it varies by insurance company. Again, some plans do not require you to have weight management visits. They feel like if you are seeing us and if you're at this stage, you've had several attempts and there's no sense in making you do specific visits. And then some of them require you to have 3 months. Some require you to have 6 months. If they do require you to have any weight management visits, it could be with your primary care provider, or it could be with us. But whichever the situation is, we know what your requirements are. Some of them require you to have consecutive visits. So if you have 6 visits and 5 of them were consecutive months, and you skipped a month and they require you 6 consecutive months, that would mean that you would have to start all over with that. And then some of the insurances require you to have a BMI history. They want to make sure that this isn't your first attempt at losing weight. Most of them require maybe 1 or 2 years. Occasionally, we'll see an insurance that requires a 5-year BMI history. All it is, whatever the requirement is, we just make sure that we have a copy of your notes for the providers that you've seen. It can be any provider on the yearly basis, and we send that documentation to them to see what your weight history has been. Insurance carriers that we accept. We're always asked, do you accept my insurance? We accept all insurances that will allow us to enroll in their programs. That's pretty much the bottom line. Just because you see up there that, oh good, Aetna, I have Aetna, so I have benefits. Aetna may have bariatric benefits, but the employer may exclude it from the plan. So these are the ones that we can tell you we participate with, but we know if Medicare covers it and the Medicare Advantage plans do. We know the state employees, that's a given. TRICARE, Champus, and VA, those are a given. But then any of the commercial plans, we just have to check and see if the employer has it, because if it's a plan that does offer it, then like I said, the particular employer may exclude it or have different criteria. Insurance carriers that I can tell you that do not have benefits. Medicaid only. At least for the state of Mississippi, I don't know about other states, but if you have Medicaid only, it is not a covered service. If you have Medicare as your primary and Medicaid as your secondary, Medicaid is set up to where it pays for the out-of-pocket portion after Medicare pays. So in that scenario, it does coordinate and it does pay. It's just if Medicaid is independent. Humana. Humana is a plan that our hospital does not participate with patients having the option, if you're on Medicare, to pick an Advantage plan. There's Aetna, there's United Healthcare, there's Humana. Starting in October, that's pretty much all you saw in commercials, is people telling you the additional benefits you could have with their plan versus the traditional Medicare, which is the red, white, and blue card. However, with the Humana Advantage, we are not participating providers with them, so there has to be a waiver obtained. So sometimes patients choose to go back to the traditional Medicare because it's easier for them to follow the criteria than to obtain a waiver. The Better plans, those are usually for individuals that are self-employed. The plans are very, very good. With not only in this clinic do we have bariatric, but we have general surgeons. So Better pays for general surgery services. However, in the state of Mississippi, Better does not have bariatric benefits. And then the Mississippi CAN, which is an extension of Medicaid, Molina Health, Magnolia, and what I call traditional Blue Cross of Mississippi. You know, every insurance card has a prefix. So the majority of the plans that Blue Cross offers has, for the state of Mississippi, has a YAQ prefix. the YAQ prefix, if you have that insurance or that particular prefix, there are not any bariatric benefits. Now, the Blue Cross state insurance, the state of Mississippi for employees, for the government, teachers, highway workers, things of that nature, that prefix is YAX. So if you have the YAX, you have the plan that the Mississippi legislature voted to provide bariatric benefits for their employees. If you look on the screen, this is a lot of work, a lot of history, a lot of accomplishments, and great outcomes. When you look to the circle on the right next to Blue Cross Blue Shield, you'll see the MBSAQIP. This is accreditation for bariatric programs. It's a quality program. Every 3 years, our program is assessed. This year, we just got our next accreditation in the fall, but bariatric surgeons rotate, assess our program, make sure our outcomes, and during the time that we're preparing for the next visits, any patient that has bariatric surgery, our outcomes are entered in a national database that's compared across the country. And we are measured with our outcomes with our peers. So ever since we have had, in 2012, that was the first time we were accredited. We have gotten outstanding outcomes and recommendations to be accredited. So once you obtain that status, then insurance companies look to you to be their provider of care. Now, to be able to participate in these other programs, you have to be an accredited center. So our clinic and our hospital, we're accredited. Vivian is our bariatric program director for the accreditation. So she works very hard to make sure that we're compliant with all their requirements. Blue Cross Blue Shield of Mississippi, we are really, really excited to say that we have recently obtained this designation. Each state has Blue Cross coverage. And then in each state in the nation, there's all other kinds of Blue Crosses. You have to be a participating provider in your particular Blue Cross state. And then if you're participating, your state looks at your outcomes and determines if they're going to allow you to be a Blues Distinction Center. And Blues Distinction Center, again, is based on your outcomes and your accreditation. So if you're not an accredited program or do not have a Blues Distinction status, a lot of the Blue Cross carriers will not allow their patients to come to us. So there are employers in the state of Mississippi that their home offices are in other states, but because we were not a Blues Distinction Center, those patients could not come to our program at that time. Now, not only are we a Blues Distinction Center, we're a Blues Distinction Center Plus. So that's the highest level of accreditation you can have. If you have a Blue Cross from an employer or another state, you can go on the website on the back of your card, and it will, when you look under bariatrics, if it requires a Blues Distinction Center, it will direct you to the ones in your area. We had a lady to call us last week. She lives in Canton, Mississippi. And she had looked a couple of weeks ago, and the closest ones near her was in Louisiana and Alabama. Well, she went back to look again, and since we've received our distinction, we were added to that. So she called us because she wanted to come through our program. So not all insurance websites will tell you if they have bariatric benefits, but if your plan requires a Blues distinction, it will tell you. Some of them pay at a reduced rate. I know Cadence employees, the Bank Core South employees, they allow their patients to come to us, and they paid at 70-30, 70% for them and 30% for the patient. Now that we're a Blues distinction center, they pay 90-10. So we make sure that's not an issue anymore for us because we're a Blue Distinction Center. But because you're coming to one, you could have better benefits from that standpoint. The Optum, that's United Healthcare. Every year we have to submit an application to maintain our accreditation with them. Same thing applies with them. You call them and ask about going to a bariatric program, they will mention our program because we are accredited through them. Cigna, we are accredited as well with them, and then with Aetna. Aetna does it a little different. Aetna bases it on their outcomes. So as patients come to see us and have good outcomes, they measure that based on the successfulness of the patients and the outcomes. So we are real pleased and proud to say that we have these distinctions. And so if you have United Healthcare and they require you to go to an Optum program, then they will point you in our direction. So that's just a little bit of information about our program and the success of it. And as a patient, that should be important to you too, because you want to have exceptional outcome at the place that you choose to have your surgery. So what's next? We just kind of wanted to go over a few things. Not everybody that's interested in having bariatric surgery has bariatric benefits. So we're upfront. We tell you what our fees are. If you do not have bariatric benefits in your plan, or if you do not have insurance, the gastric sleeve is $12,500. You see the amount up there for the surgeon, anesthesiologist, and then the hospital fee. When you're comparing, make sure you're comparing apples to apples. If you're looking around because you're paying for it out of your pocket, yes, there's programs in Tennessee. Yes, there's programs in Alabama. Yes, there's programs and other programs in Mississippi. And yes, I will say it, there are programs in Mexico. Not all programs are created equal. So if somebody tells you that their plan is, we'll say 11,000, you need to compare the apples and apples. You need to know what you're getting. The screen I showed you before, you need to know if their accreditation level. When we say that your fees for the hospital, our primary surgery day is Tuesday. You would stay in the hospital 2 nights, Tuesday night and Wednesday night. And then you would go home Thursday. There are programs that do their surgeries outpatient. And there's programs that do their surgeries outpatient, then they have you stay in a hotel across the street. If you stay at a hotel across the street, you don't have 24/7 care. You don't have, you're not on a dedicated bariatric floor, and you don't have nurses that are formally trained specifically and dedicated to bariatric patients. So sometimes cheaper is not always better. And I can definitely tell you the education that you get for our program from the nurses, the physicians, Vivian and Ginger, you just can't beat it. We have a dietitian that is full-time in our program, and a lot of programs it's the surgeon and then they give you names for the psychologist, or they give you names to see the dietitian. Our dietitian is dedicated to bariatric patients, and that's all she sees. That's all she talks to. And you're available, she's available to talk to you when you have questions during this process, right after you have surgery, and then down the road. So just want to make sure that when you're looking at everything, if you're having to pay for it out of pocket, make sure you're getting what, it's apples to apples. I'm all about a bargain, but I want the best care I can have when it comes to my health. Now, some insurances, will pay for visits, but they won't pay for the surgery itself. So we'll try to figure that out for you before you have surgery. I can tell you that if you have to have any other studies or tests, if you have to have a GI workup, if you got signs and symptoms for a GI problem, your insurance is going to cover a GI visit or a GI workup. Same thing if you're having shortness of breath, or you're not walking far and we refer you to a cardiologist, your insurance will pay for that. We don't send you to other providers for screening reasons. If there's a reason that you need to see another specialist, we want to make sure that you're cleared. Or if you see a pulmonologist and you have sleep apnea, that you're wearing your CPAP when you're at the hospital, because we want to make sure that you're breathing correctly while you're put to sleep. So to kind of answer that, if you're having any other studies, that would be covered if you do have insurance, because that's not specific to bariatric surgery. Our payment options, we take cash, cashier's check, and we just started participating with Care Credit. That is something we've been interested in wanting to offer for quite some time. So we are just in that the beginning stage of that. When you come to the office, we will talk to you and tell you what your out-of-pocket portion is. If you're saying, I'm not sure if I can pay for that, we'll give you, if you're considering Care Credit, we'll give you a brochure. It'll let you put in the amount that you would be responsible for. And then there's different options. There's about 4 or 5 options. And you could see, if there's an option that works for you. Some patients are already familiar with Care Credit. They've used it for orthodontics or dental work, or even some for veterinary services. So we're just pleased that we're able to offer this. And not only would it cover the surgeon's fee, but Care Credit is available for the services when you're at the hospital. Like I said, there are health insurance coverage, but they have no bariatric benefits. So if they pay for everything when you come to the office and your visits for things, everything, the surgery portion would be considered as the cash pay option. Health insurance with bariatric benefits. We know the plans. They're pretty much around here: Toyota, Cadence, state employees, hospital insurance, things of those natures. We know their requirements. If it's a new employer or a new insurance, we will verify, we will reach out, we will find out what the requirements are before we contact you to schedule an appointment. We also check on a yearly basis. New criteria may take place. At the end of the year, every plan that we have that we use, we went online, we verified to see if they had new requirements. Some of them had done away with weight management. Some of them had eliminated the requirements for BMI history, and some of them had added additional diagnosis. So it's important for us to know what to tell you. When you come to your first visit, we're going to be able to tell you what your insurance requires, and then after you see the surgeon, what he wants you to have scheduled and what he wants you to have done, like a clearance of something like that. So when you come in, you know you're going to have to see the dietitian, you're going to have to see the psychologist. Your insurance requires 3 months weight management, or you need to do this or you need to do that. If you're a smoker, I can tell you nobody allows you to have surgery, surgeons or insurance, if you're a current smoker. Some insurances require you to be 6 weeks nicotine free before you can qualify for surgery. Federal employees, they require a patient to have 3 months weight management. However, the patient has to be nicotine free for 6 months. So you're already behind if you have federal insurance, and you're having to wait 6 months because from the day that you have a nicotine test showing that you're free. So these are, things that we will tell you when you come in to see us. But the portion that you would be responsible for is whatever your copay is. If you have a co-insurance, a deductible, and any remaining out-of-pocket portion. Some insurances has a deductible, and the deductible goes toward the out-of-pocket. That's great. Some insurances we've seen, if you're being admitted to the hospital, because it is inpatient, all you have to pay is the inpatient copay. You don't have to pay the out-of-pocket portion, because the out-of-pocket portion applies to services that are rendered outpatient. So we will have that all prepared when you come to see us. So you know this is what you need to do before you have surgery. And this is what you look like from a financial investment standpoint. Questions? What questions does anybody have?
Right now, Terry, I do not see.
Well, like I said, we don't want you to worry about, what, is my insurance covered? What have I got to do? We try to know everything we can from from when you come in, and you'll have a folder, you'll have a sheet with everything. You'll meet with Julie. She'll have check marks on what you need to do. And as you go to those visits, as you do things, then you can mark those off their list, and we keep up with what you need to do. Yes, I see a question.
Let me see. I'm trying to find the question.
Glad to hear it. A lot of you got some answers.
Okay.
There was somebody had a question about starting in October and was hoping to have surgery in April. I don't see that chat question anymore.
Yeah, it's still on there. It says that they had their first visit in October and hoping to have surgery in April. Do I need?
I had my first visit in
sure?
October, hoping to have surgery in April. Do I need to make sure nothing changed at the end of the year? If it has changed with your insurance, we will know that. I don't know when your next visit is, but you're more than welcome. Either call the office or stop by and see Julie, because if something has changed, we would have added or updated that to your plan. But we will be more than happy to see. Now, if you've changed insurances, that's a different story. One thing I will tell all of you is, if you started out with us with one insurance and in the middle of it you've changed, please let us know, because we will have to verify that. Your employer may have changed insurance. We try to stay abreast of that. And or you may have changed jobs. So if anything changed midstream, please, ask to see Julie, the scheduler, so we can make sure that we've got what we need. We had a patient that had traditional Medicare at the end of the year, and she signed up for Medicare Advantage in January, and that the Medicare Advantage she signed up for required 12 visits versus the 3. My BMI fall below covered level and out-of-pocket fee is too high. Are there other bariatric weight loss treatments available at this clinic? At this time, we are not offering anything else. We are looking at providing services to patients that either want to lose some weight, they can't, they do not have bariatric benefit, and they need help losing weight. So just kind of touch base with us every so often. We may be doing some weight management services. And then, some patients, as they've had surgery, they need some more guidance to stay on track so they continue on their path. So just keep us, check with us periodically, and we'll let you know. We'll probably do, an announcement on our website or the newspaper if we do specific weight management services. Any other questions? One is, after the third weigh-in, how soon do you have surgery? Is there a deadline? If your insurance requires you to have 3 months weight management, if you've had everything done that your insurance and the doctor asked you when you come in for your last visit, whatever number that is, that will be the time that we can talk to you about scheduling a surgery date. We usually go with what works well for the patients. Sometimes, depending on what the insurance is, there's some insurances we get answers in 2 and 3 days, so we can schedule those kind of quick. There's some of them that require 15 working days before, because everything that you do, everything that is required, we print that off, we prepare it, and we send that to your insurance company, and they look at it to make sure that you have met the requirements. And with us organizing it and sending it in, it makes it really easy to get approvals. Sometimes they may need clarification, or there's times that the surgeons have done a peer-to-peer. And with a surgeon talking to a surgeon, sometimes that makes the difference in a patient being approved based on what they read in paper. If my BMI was not greater than 35 over the last 20 more months, will I have to wait till it has to be 35 for at least 24 months? Depending on what your insurance is, I can tell you, if you're a state employee, they require you to have a BMI of 35 for 24 months. It's not 2 separate years. Calendar years is 24 months. But again, I'm not sure which your insurance is. I know the hospital employees and the state employees, they require 24-month BMI. A lot of them do not require any, and some just require 1. But if, like I said, at this particular time, the standard of care is 35 for insurance requirements. There is a Blue Cross of Illinois. Some of their employers are allowing it to be 32 and above. So I anticipate that this will be a moving target and changing, because according to the society, they say the outcomes, that the quality of care and life changes for patients, and the reduction in comorbidities and the expenses for medications outweighs, it's such a great benefit that it needs to be dropped down and allow more patients to have, to qualify as surgical candidates. Any other questions? We still got time. I'm a little short on talking, but I wanted to give you the points that were important and hopefully maybe resolve some of your questions, and then you would be prepared when you came in for your visit to know what to expect. Well, I'm assuming no further questions means there's not any. So everybody have a great night. And those of you that are in the program, we're looking forward to you coming in and getting your surgery date. And those that you are considering, we hope to hear from you and see you soon. Good night.